Hello, 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 hello. I t- I might have to adjust this because I'm super tall. Basically, my name is Phil Samba. I'm a Black British social activist and writer. I also am the strategic lead of Prep for Women of Color at PrEPster, which is an organization designed to educate and agitate for PrEP access in the UK and beyond. I have to start off with who are queer men of color, and I want to talk a lot about the issues that they have and what can we do to resolve them. Although I am targeting specifically at queer men of color, there are, I think, a lot of things that I do or that I have done that can help a lot of different demographics, such as sex workers or trans people, etc. Queer men of color are far less likely to take PrEP in comparison to their white counterparts, and that must change. We've been told that we are hard to engage or hard to reach, and I don't think I massively disagree with that. I think that we're just looking in the wrong places. First of all is representation. There's a lack of specifically targeted campaigns at queer men of color. Things can be done quite easily, and I think if queer men of color are at the forefront of their campaigns, like as part of developing it as well as being in it, not just standing in front of a camera, then we can make a difference. We need more campaigns by queer men of color for queer men of color. There's also a lack of voices and experiences of queer men of color talking about their sexual health and their PrEP use. We need more content of people talking about stuff. I have a video, and I'm not sure if it's going to play, so I'm going to try, and if it doesn't, then I'll move on.
Like, I guess get PrEP into the community from the science that's behind how it works.
I think you got to find like the right avenues to spread the message, and I suppose it can't always be in like a clinic or at a hospital.
Yeah.
It's got to be where people are more socially active, and it's just got to be more accessible. I think the usual places that we would think are just not good enough anymore.
That's true.
And I think a lot of it actually has to do with personal relationships and talking to your friends and being open to talking to your friends about it, because unfortunately there can still be a bit of stigma around it, and I think it's actually just moving past that, especially with people that you care about, and saying, hey, this is something that I'm doing, I think it's really, really important, and I want you to hear me out. And I've done that with a few of my friends, and a few times they might have reacted a little bit shocked at first, kind of, especially when HIV is ever mentioned. But then when I actually went into detail, did you actually know that I'm much more susceptible to contracting HIV than my white counterparts? And then they get really interested in why. Yeah. So that, for me, was what as well.
So do you think...
So we must be represented as multifaceted people outside of, that basically have more requirements than from sexual health services outside of risk and reducing infections. We need to be seen as actual real people. So next is research. There's also a lack of specific and extensive research of queer men of color, particularly black men. We basically need to stop. We tend to use a lot of US data, assuming that because we're all black, we're all the same. And as a black British man with African American friends, I can guarantee that we're all very different, and we have different needs and different experiences, so there's different results. We should be conducting our own research on our own people in our own countries. Recently, there was a study on the motivations and the barriers to PrEP amongst black women aged 18 to 45 in London at the London School of Hygiene and Tropical Medicine. And it proved to be really beneficial, particularly to the work that I did. It's the first time that PrEP was studied in that way amongst black men in the UK. Yeah. It helped my activism as well as my writing, as well as my project, and it kind of changed the kind of conversations that I was having with different people. So going into tailored and peer-led approaches, I think we have to start thinking about where people are having sex. I think I'm kind of reiterating a lot of what's been spoken about before. But where are these people having sex, and what kind of things can we do? When I talk about outreach, I'm not talking about the typical physical outreach that we do regularly. I'm talking about things that we can do that are outside the box or different to what we're doing. Earlier, we were mentioned digital outreach came up before, and doing things kind of differently and using things like dating apps. So with the research that I talked about earlier, the London school managed to recruit 25 black men from gay dating apps. And there's also like underground sex networks on things like social media. So there's things you could do with targeting, with digital ads. Social media should have a much bigger role in improving sexual health knowledge. We need to think about whose social media are we using, and I feel like it should come from people that are from these communities so that there's a level of trust. I also feel that we should be utilizing workshops that from pre-existing organizations that have people, queer men of color that are already meeting that have low levels of sexual health knowledge. Yeah. In closing, I'd just like to say that although HIV mirrors the inequality in the world, I feel like this is about equity and not equality. It might take longer, it might be more difficult, and it might be more work to get queer men of color talking about PrEP and embracing PrEP, taking PrEP and telling their friends. But just because it's more difficult doesn't mean that we shouldn't do it.